Artificial intelligence. It's not some distant science fiction idea anymore. It's here, right now. It's in our therapy notes, it's in our assessments, it's even helping shape our treatment plans. The whole mental health landscape is being reshaped by AI, and it's happening at an incredible speed. So we really have to stop and ask ourselves a huge question. Are our ethics ready for this? And let's be real, for a lot of us in this field, this time of year means one thing, that scramble for continuing education credits. We're all on the lookout for those essential ethics hours to keep our licenses active. It's just part of the job, right?
But here's the catch. So many of the CE programs out there are kind of looking in the rearview mirror, just covering the same familiar ground. What they're missing is the single biggest ethical challenge that's staring us right in the face: artificial intelligence. And it's leaving us completely unprepared for the tools we're already starting to use, probably every single day.
Okay, so let's really get into this. The whole challenge with AI, it isn't just about the tech itself. It's about the very heart of what we do. It's about the therapeutic relationship. So the risk we're facing isn't technical, it's relational. How do these incredibly powerful new tools actually impact that human connection that makes counseling, well, work? Think about it. Trust is the absolute foundation of everything we build with our clients. So we have to wonder, does using an AI to help with notes or suggest treatments make a client feel more seen and understood? Or does it create this weird distance, this feeling that there's some kind of third-party algorithm sitting in the room with you both? This is a question we absolutely have to answer now.
And then there's the whole accountability piece. What happens if an AI platform gives you a flawed assessment or a harmful recommendation and you act on it? Who's on the hook? Is it you, the clinician, the software developer? This creates a super complex web of liability that we're all trying to figure out, and a lot of the time we're doing it without a map.
And it gets even stickier when you start thinking about bias. I mean, these AI systems are trained on massive amounts of data, and that data can be absolutely packed with existing societal biases. So the question becomes, are you really prepared to spot when an AI suggestion might be culturally out of tune, or worse, actually perpetuate harm against marginalized clients? This isn't just a tech skill anymore, it's a core multicultural competency for a digital age. So here's the bottom line. Our current ethical codes, from the ACA or the NBCC, they're essential. They are our foundation, but they just weren't designed for the speed and complexity of AI. They don't give us a practical, in-the-moment guide for deciding whether you should use this specific tool with this specific client right now. This is exactly why we need a new way of thinking about this. We need something that goes beyond a simple checklist of rules. We need something that actually equips us with a framework, a way of thinking that's grounded in the very thing we're trying to protect, that caring, therapeutic relationship. And that new approach is a philosophy called care ethics. Now, this isn't about memorizing a bunch of new regulations. It's a framework that puts the relationship, the context of the situation, and your responsibility right at the center of every single decision. It teaches you how to think about AI, not just what to think. The guiding principle here is actually really simple. Relationships come first, period. Technology has to be our servant, not our master. Its one and only purpose in our work should be to support the human connection that allows for healing. Any tool that gets in the way of that connection is a tool we have to seriously question. So how do we actually do this? Well, this whole framework is built on 5 core principles. First, attentiveness to the client's actual experience. Second, taking responsibility for our own clinical judgment. Third, having the competence to actually use these tools well. Fourth, responsiveness to the individual's unique needs. And finally, and maybe most importantly, protecting that foundational trust in the relationship. It's a clear, practical guide you can actually use. And the great thing about this framework is that it's not just for clinicians who've been in the field for decades. This is a vital skill set whether you are just starting out as a student, you're deep in the trenches of practice, or you're one of the amazing people shaping the next generation of counselors. Let's break that down a bit. If you're a student, this helps you build the right ethical foundation from day one, before you even start practicing. If you're a counselor right now, this gives you the clarity and confidence to navigate the tools that are already on your desk. And if you're a counselor educator or a supervisor, this gives you the language and the strategies you need to guide your students and supervisees through this new landscape. And we've put all of this into a comprehensive certificate program. It's designed to give you a clear advantage in a field that's changing faster than ever. This isn't just about keeping up, it's about learning to lead. And yeah, let's circle back to that practical need we talked about at the beginning. When you complete this program, you get 6 NBCC-approved ethics hours. So you can check that box for your licensure requirements while gaining what is probably the single most relevant ethical skill set for the future of your career. But it's about so much more than just getting your credits. You're going to walk away with real, tangible tools like decision-making worksheets you can use over and over and specific strategies for supervision. And, of course, you'll earn a certification that really shows your commitment to ethical innovation in our field. This isn't something just thrown together. This program is built on serious expertise. It was developed by Dr. Michael Jones. He's a board-certified telemental health provider and a specialist whose work is focused specifically on this, applying care ethics to AI and counseling. So you're learning directly from a leader in this brand new field. And we made sure it's designed to fit into your actual life. It's 100% online and totally self-paced, so you can make it work with your schedule. You get access right away, and you don't need to be some kind of tech genius to do it. All you need is the desire to practice ethically in the world we live in today. The certificate program officially launches on November 28th. This is really your chance to go beyond just checking a box and start actively future-proofing your practice and, honestly, our entire profession. So I guess the final question is really for you. AI is here. It's not going anywhere. The ethical dilemmas are already knocking at your door. The real question is, are you ready to face them? Not with anxiety or uncertainty, but with a clear relational framework that gives you confidence and, most importantly, protects your clients.